discuss the clinical anatomy of the eye. There are so many conditions or disorders or diseases that can affect our eyes. The major function of the eye is to allow us see and differentiate between colors, whether it is a blue color, black color, red color, or whatever kind of color, and also to be able to see or visualize objects around us. These are the main functions or major function of our two eyes. You get it? Because the eyes are two, one can see with only one can function with only one eye. So, but if the two are damaged, then somebody becomes blind. So when somebody is blind, you cannot see anything. And the main reason why we are able to see with our eyes is as a result of our intact optic nerve. That is the second cranial nerve, what you call the optic nerve. That optic nerve, it is located at the back of the eye, and it begins from inside the eyeball. The eyeball has three layers. The first layer, that's what we call the sclera, and the choroidal layer, and then the retinal layer. So the retinal layer, that is where the optic nerve begins. So the retina is just like the screen. Just like this screen you see, I'm writing something on it. So the retina is the screen by which any object that we see is being projected or focused on the retina for the two optic nerves to carry and then take that sensory information to the visual cortex of our own brain. So, the eyeballs are located inside the two orbits. Our orbit, is just like a pyramid. It is a hollow space there, and it has four walls, superior wall, inferior wall, lateral wall, and medial wall. Are you clear? Or you can say the superior wall is the roof, while the inferior wall is the floor of the eye, of the orbit or the eye socket. You get it? And so, if you now look at the skeleton of the eye, the borders, the orbit has a base, and so this base of the orbit is more or less like a square shape. You get it? So it has an inferior border, medial border, lateral border, and superior border. And so from inside you have all these walls there. You get it? So it's just like a pyramid. So it is through this opening, the optic canal, through which the optic nerve, carry this information from the retina of the eyeball here, and then the optic nerve gets out to go into the cerebral cortex or the occipital cortex, the occipital lobe. So at times this orbit, during injury, trauma, maybe during fight or during accident, the eyeball can get fractured and it may affect the eyeball. So, that around the orbit, at the inferior border or from either of the walls now, there are blood vessels, either arteries or veins, going into or out of the orbit. Those vessels can get injured once this orbit is fractured, and the orbital cavity or the orbit itself, the bleeding may take place, and then the eye cavity may contain blood in there, and that may affect, the eyeball. You get it? So, and apart from the fracture of the orbit or bleeding inside the orbit, one can also have what you call strabismus, what you call squint. You get it? If you look at your own friend, or if you look at your face on the mirror, when you are looking at the mirror, you will see that the black aspect of the eye, of the two eyes, they line up at the same direction. So if you are focusing centrally, you will see that this black area of the eye, they're all in the center when you are focusing centrally like that. So if you are now looking towards your right side, you will see that all of the two black portion of the eye, they look towards this right side. So this black one will now go to this side, this one will now go to this side. So it means the black one here will now go towards the lateral side because this is the lateral aspect. The black aspect of the eye here will now go to the medial side because this is the medial side of this eye. Are you clear? So they now go in the same direction. So once you now see somebody, the two black portion of the eye, of the two eyes now, they don't line up in the same direction. Whether you want to look left, or you want to look right, or you want to look centrally. If they don't line up at the same direction where you are focusing, that is what we call strabismus or squint eye. Squint, you get it? So what shine muke kira da Hausa hararagarke, something like that. So this is a normal, this guy is focusing centrally like that. You get it? So you will see each of this black portion now is at the center. Are you clear? That is the iris. We're talking about the iris. That is the black portion of it. So once you have that, one is located at the center, the other one is located down. That is what we call hypotropia. It's one category of strabismus because strabismus is made up of 4 varieties. We call number 1 what you call hypotropia. That means one, if you are looking centrally like that, the iris looks centrally of one eye. The other, the affected eye now, the black portion is down. That is what you call hypotropia because the black portion is pointing downward. The other one is facing or looking upward, but the other one is central. That is what you call hypertropia because the black portion of the affected eye is looking upward. Are you clear? That is what we call hypertropia. The other one is what we call exotropia. That means if the guy is facing centrally or is facing you, the normal eye, the black portion is at the center, the other black portion, the affected eye, is on the outer angle of the eye. That is what we call outer contours of the ear. So that is what we call exotropia because it's looking towards the outside. The other one is what we call esotropia. That means the other normal eye, the iris is at the center, the other one is facing towards the medial side or inner side of the eye. That is what we call esotropia. So strabismus or squint is made up of 4 times. So at times, if you look at some of your friends, they do have it. You know, it's common in our environment. You see some people with this squint or strabismus. You know, so mostly their own vision is not as normal as our own, because if the eye don't focus on the same direction or they don't focus on the same line, somebody will be seeing things differently. So one eye is looking at one object, the other eye is looking at another object. So they don't focus on the same object, the 2 eyes. That is what we call squint. Are you clear? So we now know that. The other one is what we call, other condition that can affect eyeball is what we call glaucoma. Glaucoma is now becoming very rampant in our society. And that is why I urge you guys, if you have a chance, go to the clinic so that they can check your eye. It's very, very common. And one major problem with this glaucoma is that it doesn't give notice. It just comes suddenly. While you are having lectures like this, you just stop seeing completely. It may affect one eye or may affect both eyes. And by the time you notice that you can no longer see well with that eye, the damage has already been done. And that is why it is very, very important for every one of you, whether you have history of glaucoma in your family or you don't, you go to the clinic so that they can check your eyes. It's very, very important. Somebody like me now, I used to go to clinic every 6 months. They check my whole body, everywhere in part of my body. They check everywhere to see that I'm normal. That is ideal situation. Every 6 months, if you are lucky, if you have money, or you have somebody that can help you, go and do general body checkup, not only for your eyes, total part of your body. Because by so doing now, certain diseases can be discovered in your own body and can be treated earlier, especially the one I discussed with you, the breast cancer. That's why I advise you guys now, every morning when you wake up, even the men, check your breast and see whether you have some lumps. Because breast cancer can happen in men. So you can also be palpating your chest, the men, to see whether there is an abnormal lump around your breast, but it is especially better for women to always every morning to check your. So we have now seen glaucoma is what you call high blood pressure of the eyeball. So that's what you call intraorbital pressure. Intraocular, sorry, not orbital. We're talking about the eye, intraocular pressure. That means the high blood pressure of the eye, that is what we call glaucoma. That means the pressure inside each of the eyeball has shooting up. You get it? So that is what we call glaucoma. Once the blood pressure is high in there, then the person will start seeing double vision, and occasionally he may not even see anything. And most of the blind men you see in our own environment is as a result of this bilateral glaucoma. So that is why I urge you guys to check it. And so what happens is that glaucoma, once it happens now, it chops up the optic nerve. So the optic nerve of that affected eye is damaged. The retina there completely damaged. The optic nerve is no longer useful, so it's not going to carry any information, any visual information around and send it to the occipital cortex, and so the person cannot see. That is glaucoma. Of course, it is treatable. It can be treated by giving drugs, either a tablet or some eye drop. So the person can be dropping eye drop everybody for life. But if you are lucky, you have the money, or your government can afford, you can go and do surgery. So it can be operated, and so the blood pressure can get controlled, and then the pressure can be prevented from getting high every day. And so once the surgery is done, that is the end. But the damage that is done already can never be recovered. Once the damage is done forever. It can never be recovered. That's it. But then the continuous damage can be stopped. That's also what you call sty. That sty is just like a red swelling around the edge of either upper eyelid or lower eyelid. Something like a boil around either upper eyelid or lower eyelid. You will see it swollen, very reddish, swollen, painful, and warm when you touch it. And once you wake up early morning, you will see some eye discharges. You will see some pus coming out from the sty. So that is what you call sty, and it's as a result of blockage of the hair follicle around the eye, what we call the eyelashes. There are eyelashes. So one of the hair in the eyelash, the hair follicle can get blocked, and so the bacteria in there can, go in and then cause this sty. Or maybe the glands around the eyelid can also get inflamed and cause that sty. So what causes this kind of sty in our eyes is lack of eye hygiene. You see people most of the time, they don't wash their eyes well, especially early morning when you wake up, when you are washing your face, you don't wash well, or you tend to wash your face with a dirty hand. You touch everywhere in your own part of the body. At the end, when you want to perform ablution, you just come without washing the hand very well. You wash your eyes, and by so doing, you can have some bacteria being introduced into the hair follicle of your eyelashes, and so you can have that sty. You get it? Similarly, you can have what we call retinoblastoma. Retinoblastoma is cancer of the retina, from the word retina. Retinoblastoma is a tumor of the retina. That retina that I said is one of the 3 layers of the eye. So the retina, the screen of our eye, can get involved in this tumor. So the tumor that is what we call retinoblastoma. So that somebody that has that retinoblastoma, it mostly affects young children under the age of 5. But that notwithstanding, even adult can have retinoblastoma. So I've seen so many cases of this retinoblastoma in very young, innocent kids, very, very pathetic situation. You see a young chap with very swollen eye like that. The eyeball comes out, being projected out, bulge, with some swellings up and down like that. You get it? So this retinoblastoma, luckily, it can be, cured. The retinoblastoma can be cured by excising the tumor. So similarly, there are also some drugs that one can give. So drugs can also be given, the anti-cancer drugs can also be given, and so it can be cured. It's one of the cancers of the body that can get cured, because most of the cancers in our own body, they don't have any cure, but these are one of the cancers in the body that can get cured. There's also what you call cataract. Cataract shine muke kira da Hausa hakiya. So it's just like these glasses I'm wearing. Once there are dust in our environment, the dust can now come and block these my lenses. And if I wear it, I'm going to see, some blurring like that. I'm not going to see the object. I'm not going to see you clearly because of the dates on the glasses. That is exactly what is going on our natural eyeglass. In our own eyeball, there is what we call eye lens. So in that lens, our own metabolic, waste, whatever we eat, this carbohydrate, fat, and proteins, the metabolic process, those ones, the waste, they tend to deposit on the eye lens. And so they now cause something like a dent on that eye lens. And so that is what we call a cataract. So that one can also be treated. It can be either on one eye or can be on both eyes. If it is on both eyes, it is very much difficult for a person to see well until the cataract is being extracted. That means you open the eyeball, you now go and extract the deposit around the eye lens. So you clean the eye lens and then you now cover it up, and then the guy will now see clear, just like the way you are going to clean your eye lens and then you take it back. That is exactly what doctors are doing in there. That's also what we call Horner's syndrome. Horner's syndrome is a kind of 4-in-1 condition in which the sympathetic nerves supplying either side of the face are get affected, including the eye. So the iris, the black portion of our eye, is being supplied by sympathetic nerves for dilatation and constriction of our iris, so that if we want to focus on near object, the iris will now dilate, if we want to focus on very far object, the iris will now constrict. And so these are the functions of these our sympathetic nerves. So they also allow our either side of the face to sweat. For now, for example, now, because of this heat, when you touch your face, you will find out that there are some sweat over your face. And so it's as a result of this sympathetic nerve supply on the either side of your face, that is why you are able to sweat on the face again. And so once this sympathetic nerves supplying the face and the iris are affected, mostly of the tumor of the apex of the lungs, so that is what we call Pancoast tumor. Don't worry about that, forget about it. I'm just telling you that the sympathetic nerves, once they are involved as a result of anything, the sympathetic nerve supplying the iris and the face is going to be affected. So once it is affected, it is now going to cause 4 problems, what we call ptosis. The upper eyelid is going to drop so that it is going to be covering the affected eye like that. You get it? So if this one is open, this one is going to be happily closed. That is what we call ptosis, dropping of the upper eyelid. There's also what we call anhidrosis. That anhidrosis is dry face. So one side of the affected face is going to be dry. The other side of the face, you will sweat. The other one, there will be no sweat because the sympathetic nerve of that side is affected. So we have anhidrosis, dry face. There's also what we call miosis. That means if you are focusing on a closer object, the other iris is going to dilate, the abnormal side is going to constrict. So constriction of that iris, of that affected side, that is what we call miosis. Then there's also what we call enophthalmos. That means the eyeball sinks backward there are situations whereby the eyeball will now comes out, it will project forward, especially in what you call myasthenia gravis, or this hyperthyroidism, where the eyeball will now protrude. Okay, so that is it. So, but this one now, the eyeball sinks backward. That's what we call enophthalmos. So there are 4 conditions associated with Horner syndrome. There's also what we call diabetic retinopathy. The diabetic retinopathy now is as a result of diabetes mellitus. I'm sure you know what is diabetes mellitus, but diabetes mellitus now is a metabolic disease in which somebody has these problems with the insulin or glucose, metabolism. And so people with such kind of condition, they tend to have retinal damage. The blood vessels that are supplying the retina, both the artery or the veins, they get involved, as a result of this diabetes. And so the person will have problem with the blood vessels of the retina, and so that the eye that is affected is going to have a problem of vision. Again, you can also have what you call red eye. Red eye can be caused by anything. You will see at times your eye is red, probably because something has gone inside the eye, as if you are walking. Because of dust, the dust enters into your eye. In trying to clean it up, you tend to squeeze the eye, and so the eye gets red. Or maybe there's a trauma, somebody gives you a blow on that eye. The blood vessels, can tend to, come to protect the eye, and so the eye will become red. And again, as a result of injury, trauma, when somebody gives you a blow, or maybe there's an infection, what we call conjunctivitis, somebody that is using a dirty hand to wash his face, the infection or the bacteria can also affect the eye and can cause the conjunctivitis or can cause that red eye. So also chemicals like acid, when you are going to the laboratory, you are doing some experiments, acid may splash into the eye, or alkaline solution can also splash into the eye, or kerosene or petrol, anything chemical can, once it splashes on the eye, can cause red eye. Pollens of flowers, once they get into the eye, can also cause red eye, to cause allergic reactions of the eye. Even catarrh infections, when you have catarrh, can also cause red eye. You see somebody's eyes are red as a result of catarrh. So the viral infection can also affect the 2 eyes during catarrh. So many conditions can make the eye red. So there are so many causes of the red eye, and so you have to treat the cause for you to be able to treat the red eye. So